Hi, good morning. I'm Tyra Douglas. I'm a third year anesthesia resident from the Kingston Public Hospital. It's been extremely informative. The lectures have been awesome. It's very applicable also, not just to emergency medicine, but also to my field. And I've learned a lot. I'm hoping to carry all my skills and knowledge back to KPH, or at Kingston Public Hospital, as we say. We used it yesterday. The technology is astounding. I think it will definitely benefit us. The fact that you can do so many different scans with it, especially the cardiac, it's probably the ones that actually amazes me the most. It's been good. It's been good. Amazing technology.
Do you think it's a game changer?
For sure. I think it's something that will continue to help Jamaica in years to come. As they say, partnerships work. You just need like-minded people, and we hope that it continues for another 15 years.
I'm Dr. Dajana Adams. I am in emergency medicine at the Kingston Public Hospital. I find the course to be very informative and insightful, and I am really excited to put what I've learned here into practice. At Kingston Public Hospital, especially in the emergency room, we see a lot of trauma cases, a lot of penetrating injuries to the abdomen and to the chest, and I am really excited to practice this knowledge there and to share the knowledge with my colleagues and the techniques with my colleagues. I think that it's an excellent tool to use in the emergency department, especially since you can carry it from place to place in the ED, so it is beneficial, or it will be beneficial to us there. Thank you, JAHJAH Foundation, and keep up the good work. I'm really thankful to be able to benefit from this partnership. Thank you so much, and I know that my colleagues at Kingston Public Hospital will be grateful as well.
Okay, my name is Alicia Blackmon. I'm Dr. Alicia Blackmon. I'm a third-year resident in the DM Emergency Medicine program at the University Hospital of the West Indies, Mona. So far, it has been very interesting. I have learned a lot of new things, and I have reiterated all the things that I already knew. The teachers have been very interactive, and getting a chance to practice on the models have given us better hands-on to get little tips on how to do things much better than before. I think it's awesome. It's great because of the easy portability of it, the fact that I'm using one probe to scan all of these different areas. For a small device, I find that the cleanness or the clearness of the images are nice, and there are other little things that I found very interesting, such as the ability to calculate the bladder volume. So overall, I find that it's a very useful instrument, and I'm looking forward to be working with it. I think this is an excellent initiative. I think over the 15 years, from what I've heard, it has benefited Jamaica greatly. From an emergency medicine point of view, ultrasound is very important to us in how we manage patients, and so the teaching aids we've gotten in that respect have been essential to help us in our day-to-day activity. I would like to thank JAHJAH Foundation for making such an impact on us here in Jamaica. We are very grateful for all the help that we have gotten so far, and I know that it's not just affected us as doctors, but in terms of our population, the patients that come in, I know that they are very grateful for what we have been taught and what we are giving back in terms to them.
Hi everyone, I am Dr. JAHJAH Anderson. I am one of the senior residents at Cornwall Regional Hospital Accidents and Emergency Department. It has been an excellent conference. We have learned a lot of new modalities in terms of using our point of care ultrasound to assist us in our assessment and further disposal of our patients when they come into the emergency room. We also get emphasis placed on certain areas that we were not exposed to before, and the presenters, they are excellent, and they provide hands-on experience for everybody. And we are able from this we can see where we can actually take back the knowledge to our various institutions and improve our overall experience with our patients. Well, first and foremost, it's pretty lightweight. You can actually put it in your pocket, so it becomes very useful in the emergency room in terms of the resolution of your images that you get. I think they're excellent and high quality when you compare it to other ultrasound types or other manufactured types, right? And I think for me, the important thing is that it's an all-in-one device. So no matter what type of study you're doing, you can always use your butterfly machine. I think looking forward, Jamaica can significantly benefit from it, and I hope moving forward we get further participation from Jamaica, and hopefully everybody will share the same thoughts in terms of how beneficial this is. Thanks, JAHJAH, for everything that you've done thus far, and I hope that you will continue to support Jamaica and help with improving patient care in our hospital.
Hi, good day. My name is Dr. Jason Eifel. I'm an emergency medicine physician. I work at the University Hospital of the West Indies here in Kingston, Jamaica. It's been an awesome 2 days. Having some experience with ultrasound and coming here, it's been knowledge growth. It has been maturing me as a sonographer through the excellent lecturers and teachers that we had. Special thanks to Dr. Dixon, who really put all this together, really good. Got a lot of insights and key perspectives as it relates to ultrasound. So it has been a very informative and educational experience. Well, it was excellent getting hands-on with cutting-edge technology. I think it is an awesome initiative put on by the JAHJAH Foundation and the American Friends of Jamaica. Very appreciative of it. These probes, as I said, are cutting-edge. We can attach them very easily to our devices, and it gives excellent quality images, videos, and not just that, but what impressed me most was the support that Butterfly offers through different educational resources and the willingness to really stand with us as we learn and take on this new initiative. So well done, and looking forward to use these devices more. Yeah, thank you, JAHJAH Foundation. Jamaica is very thankful and appreciative for all the hard work you've been putting in over these past 15 years. Special thanks to the visionary again, who really pushes it, Dr. Dixon and his team, who are all here, very friendly, very, working as a team. And we're just very thankful, and we hope the good work continues in the future.
Oh, hi everybody. I'm Dr. Johnson Hilton from Kingston Public Hospital, where I work as an emergency physician. Okay, so the experience has been wonderful. It's very informative there. So we went over basics initially, then we moved to advanced stuff and some cutting edge technology, as well as things that are not yet published. So it has been awesome. Excellent learning for whatever level you are. So it doesn't matter if you're at introductory or advanced, there's something that you would have learned from this course. So quick ultrasound feedback for us is very vital. We see, especially at my institution where our patient volume is so high, it actually helps us to confirm what we suspect from history and examination, and sometimes that can make the decision whether to operate or not, and this is oftentimes life-saving in the patients that we have. And as I said before, we have some resource challenges, and having that portable ultrasound right there really makes a difference. It improves your patient's outcome because it shortens the time to diagnosis. Okay, so I was very impressed with the butterfly probes. The image quality is excellent because you're comparing that to a standalone machine that is much more bulky. When I saw the image qualities, that was very impressive to me, and it was very user-friendly. It had those presets, and all the little things that you would find at the bedside, almost all of them are there. So there wasn't a big change in the quality. So you are able to obtain proper image with a lightweight machine that is portable. And that is very essential for our patients because sometimes it's difficult to lug around the big machines and so on. And so I found it very useful and beneficial. I would like it to continue, right? But I would like to say thanks to Dr. Dixon for first taking the time and bringing his team here. And this is an excellent learning opportunity for everybody, for every level of staff in the ED. And so I would very much like it to continue.
All right. Well, thank you very much.
Yes.